any sort of medicine that they were given, and explaining why the insurance company needs to pay. So what happens is, during the sender request, they most likely get a letter from the insurance companies explaining why they had refused not to pay or reimburse the hospital for the aid given to their customer. So what this person will do in particular will send this letter to the head of the specific health department. So if it's pediatrics, they will send the letter to the head of the pediatric section of the hospital. If it's internal medicine, they will send it to the head, or maybe it might be surgery. They will send it to the head of the surgical department. So when they send it, they also send the letters requesting for the physicians to write letters and also appeals in explaining why the patient needed the health intervention or health care he or she was given, and why the insurance company needs to pay for the work of the physicians. So when that happens, the letters are then sent and attached with the charts of all that was provided to the patient during their stay in the hospital, and it's also mailed back to the insurance companies in order for them to review and see if they need to um, maybe they might deny it again, or maybe at that point they might change the decision they had made before and reimburse the hospital. So that's what usually happens in this case. And it's actually reported that hospitals reported receiving an average of 1,504 medical records requests by the end of 2016, which is up from 1,424 in the year 2014. So in the year 2014, they had received 1,424, and in the year 2016, this number had actually increased to 1,504 of requests of denials from insurance companies. So as you can see, this is a long process, because first you have to get a letter from the insurance company. After you get a letter from the insurance company of whether they have chosen to reimburse, or whether they've chosen to deny to reimburse, you're gonna have to write a letter to the physician explaining to the insurance company why they had given this patient the aid they had given, and why they had provided them with the medical help they had given, and why the insurance company needs to pay for it. And then you attach this letter with the chart of the chart of the patient, and then send it back. So there's a long process. Sometimes it takes a long time for these doctors to write the letters, because they have to take care of patients while also writing letters asking for insurance company to reimburse the hospital. So it's a long process, and it's too. As we can see, many hospitals face too much of these situations, writing a lot of letters to insurance companies asking to be reimbursed for their services. So, how to improve and change the process? Because it's a long process. What can we do in order to change the process? So, first of all, my issue with this whole system is the insurance system in this country itself. I think it focuses on making a profit based on people's health issues. Basically, basically, the insurance company are just there to make money off of people's fear of having any sort of health problem. So many people give in, put co-pay. They make sort of different sort of payments monthly, in order that whenever they get sick, they hope that the insurance companies might reimburse and pay. However, that's not what happens all the time. Sometimes a patient might be admitted to the hospital for 5 days, and the insurance company will refuse to pay all 5 days. Why? Because they might make up some sort of excuse and say perhaps the patient went to the wrong facility. They should have gone to a different facility that's less expensive, because Perhaps the patient went to the hospital because they feared that they were having a heart attack, but the insurance company will have a different idea of why they would think the patient shouldn't have gone to the hospital, because they will say perhaps your health, they will say that the patient's um, temperature wasn't up to this sort of, wasn't to their required, what their required temperature that is supposed to be, or maybe their heartbeat wasn't supposed to be past this heart rate. Some sort of different, a whole bunch of different reasons, just to say that if this patient does not meet these so and so guidelines, they should not have asked for this sort of health intervention that's this expensive, and because of that, we're not going to pay. So it's too much. And if you were to ask me, in my case, if you were to ask me, I would just say it should be a simple single payer health system. However, because we are based, we're now in a system where everyone, we have private care, private health insurance, and many people are use private health insurance. How would I improve and change the process in order for it to be faster? I would say, as of now, the process is time consuming. As I had given an example, the it's time consuming. The physicians are busy taking care of patients while also writing letters as to why some of their patients need to be reimbursed, why they need to be reimbursed for taking care of some other patients that were long taken care of and gone. Sometimes you might see some repeals from the insurance companies from 3 years ago or 4 years ago, and some insurance company will come back asking back for their money, saying that they had made a mistake when they reimbursed the hospital, so they're coming back to ask for their money back. So this doctor, instead of taking care of his patients, is now focused on writing letters as to why his patients 4 years ago needed the medicine or the health aid he was given, or he or she was given, and why the hospital cannot reimburse this insurance company their money. So it's too much. It's too much time consuming, if you were to ask me. So my solution will be to create some sort of software programs where it will not be too much paperwork, too much sending, waiting for letters to come, waiting to write letters. Just a software program that automate the evaluation, so it makes it easy for the doctors to know, to evaluate, to see whether the interventions they're giving to this patient is acceptable by um, the the insurance companies, so that they will know what's the procedures and guidelines properly. At times, the guidelines that are given do not explain every situation that can happen, that physicians can face, that the hospitals can face. There might be at times where a patient will come with a different situation that's not in the guidelines, but yet a hospital has to take care of the patients in the way that they see fit. And after that, perhaps the insurance company will still refuse to pay. So what I would suggest is to maybe create an automate software program where it's explained in details what each insurance company has put, and the guidelines they have put, and their suggestions for any sort of health intervention, and so that it could be easy for the hospital to interact with the insurance companies whenever they see that perhaps the patient needs more aid than the insurance company suggests. And also, so yeah, a software program that also formulates rebuttals for appeals on behalf of the physicians. So another software program that's easier for the physicians to create rebuttals um, to the straight to the insurance companies, because now, in this case, presently, what the physicians have to do is write letters and send it to the utilization review office, and then they also have to attach it to a chart and send it to the insurance companies, which take days, sometimes weeks. So it's stuff like that. Some stuff like that occur. So a story I could give as to why it's too time consuming is with a particular doctor. in Jacobi Hospital. His name is Dr. Collin, right? So Dr. Collin was given a whole bunch of letters asking for him to write rebuttals as to why as to why he thinks that his patients need that his service needs to be reimbursed by the insurance companies for many patients. However, this doctor has been behind because there's a lot of patients who come for internal medicine. So what the office is now facing is that there are many patients that have not gotten a rebuttal letter from this particular doctor because this doctor is what now focusing on taking care of patients while also focusing on um, writing letters asking for the insurance company to pay. So this is too much. This is too much. It's a lot of. It's too much time consuming for these physicians and also the workers as well.